Hi everyone. It's evening here. So today I'm going to present the assessment of in vivo anti-tumor activity of the different extracts of Oroxylum indicum, and this was a part of my PhD thesis. Just 1 minute. Okay. I hope you can see my slide. So plants have
Yes,
been Okay. Plants have been major source for several drugs, and it is well known that 75% of the modern chemotherapeutic drugs have their origin in plants or natural products. So for this work, the plant that I use is Oroxylum indicum, and this is medicinally important medium-sized deciduous tree with light grayish brown, soft and spongy bark, and this recognizes multipurpose medicinal tree by Ayurveda and has been used in several formulations of Ayurveda and is distributed in India, Sri Lanka, China, Thailand, Philippines, and Indonesia. And these are some different parts of the plant. And for this study, I have used the stem bark. The stem bark was peeled from the tree, and
I'm
it
really
was
can you? We are unable to. You can share your. You can move your slides. Still, we are seeing your first slide.
Oh, okay. I think then I should not maximize my slide. Maybe because of some internet problem.
Yes, now it's fine.
So can you see slide number 4 now?
Yes, I can.
Okay. Then I go on. So for this work, I have used the stem bark, which was peeled off from the tree, and it was after cleaning and drying, it was made into powder. And this is the taxonomical classification of the plant. And traditionally, the decoction of the bark is used to cure gastric ulcer, and the paste of the bark powder is applied for mouth cancer, scabies, as well as other skin diseases, and for other purposes as well. And locally, the infusion of root bark or stem bark is taken orally for diarrhea, and the poultice of the bark is applied on rheumatic pains, sprains, inflammation, as well as some other skin diseases. So moving on to the materials and method. First, the stem bark was collected as I have mentioned, and after it was shade dried and powdered, it was sequentially extracted using chloroform, petroleum ether, ethanol, and distilled water based on the polarity of the solvents, so that the compounds of the plants may be fractionated based on their polarity. So first, what was done was acute toxicity was performed both orally as well as intraperitoneally, and this was done as per OECD guidelines, and the number of mice for each group was 10. And before administering drug, the mice were fasted for 18 hours. And these are the different doses used for intraperitoneal toxicity. And after administration of drug, they were monitored for 14 days. And the anti-cancer activity was studied on Dalton's lymphoma cells, which was injected to the mice. And for this purpose, the mice were grouped into different groups. The first group is the negative control. This group received only the vehicle, the saline, normal saline, sterile saline, and doxorubicin was used as a positive control, and different doses of different extracts of Oroxylum indicum was also given uh, to different groups of mice, and they were monitored for their survival for 120 days, whether the extract can prolong the survival of those Dalton's lymphoma bearing mice or not. And the tumor response was assessed on the basis of median survival time and average survival time. And the increase in mean lifespan, increase in average lifespan, and increase in lifespan were also calculated using the formula given in the slide. And these are some photos of mice that has been treated, and these are some untreated mice. In case of some treated mice, tumor was not developed at all in the optimum dose. So after acute toxicity, micronucleus assay was also performed here. Uh, in case of survival, the mice were given treatment for 9 days, but in case of micronucleus, because especially in the optimum dose, it was difficult to get tumor cells if we give the treatment for 9 days. For this purpose, we give only a single dose treatment of 300 mg per kg body weight of the ethanol extract, which was the optimum dose, or zero point 0.5 mg per kg body weight of doxorubicin. And after 1 hour of giving treatment, 150 microgram of cytochalasin B was also given so that it will suppress cytokinesis. And the mice were euthanized at 6, 12, 24, 36, and 48 hours post-drug administration. And after that, the cells were taken out and stained with 0.025% acridine orange, and the number of mononucleated or binucleated cells which bear micronucleus were counted. So these are some micronucleus pictures. Mononucleated cells that bear micronucleus, as well as the binucleated cells that bears micronucleus. And the next essay is apoptosis. And for this, the grouping and the treatment was similar to the micronucleus assay. The mice were euthanized at 1, 2, 4, 6, 8, 12, 24, 36, and 48 hours post-drug treatment. And for the stain, freshly prepared ethidium bromide and acridine orange were used, and the live necrotic as well as apoptotic cells were counted, and the apoptotic index was calculated as given in the slide. And this is some progressive stages of apoptosis. And the next assay is DNA fragmentation assay. This assay is a hallmark of apoptosis. So it is to further confirm that the extract cause apoptosis in the cancer cells. So I don't think I should say all this procedure. And the DNA fragmentation was visualized under 265 nanometers UV light after staining the gel with ethidium bromide. And for biochemical assays, glutathione transferase, superoxide dismutase, catalase, and lipid peroxidation was also performed on the tumor cells. And this was done after these assays were performed as per standard protocols after 9 days of treatment with the optimum dose, which is the 300 mg per kg body weight of ethanol extract of the Oroxylum indicum. And in order to estimate toxicity of Oroxylum indicum extract in the liver and kidney, uh, aspartate transaminase, aspartate alanine transaminase, ALT, and uric acid and creatinine assays were also performed in the serum after treatment of those mice for 9 days. So the statistical analysis were performed using Excel and Origin, and all the results were expressed as mean plus minus standard error mean, and experimental data were analyzed by one-way ANOVA followed by the case multiple comparison for different parameters between the groups, and a p-value of less than 0.05 was considered as significant. So in case of moving on to the results, uh, in case of oral acute toxicity, uh, there was more than 14 days survival on 2 gram per kg body weight, which is the highest dose we can test for. So there was no toxicity if we give this extract to the mice orally, and these are the LD50 in case of the different extracts when we give them in using through intraperitoneal injection. And these are this slide shows the body weight change of Dalton's lymphoma sites bearing Swiss albino mice of the after treatment with different extracts. You can see here the black one is the uh, untreated one, which is the negative control, and there was increase in weight in those mice because of the development of the tumor. And these are the optimum doses obtained for the different extracts, and the best dose for each of the different extract. So in case of chloroform extract, the optimum dose was 250 in case of mg per kg body weight, and in case of ethanol, it was 300 mg per kg body weight, and in case of aqueous extract, it was 400 mg per uh, kg body weight. And we have observed best survivability uh, in 300 mg per kg body weight of ethanol extract. And this slide gives the survival plots of mice treated with the different extracts, as well as doxorubicin, which was used as a positive control. So these black lines are in case of the negative control, which did not receive treatment. Most of the mice, all of them, they do not survive beyond 21 days or 20 days. But in case of treated mice, the survivability was prolonged, and that the lifespan was longest in case of 300 mg per kg body weight of ethanol extract. So this dose was chosen for further experimentation. And these are the alterations in the different endogenous uh, enzymes of the Dalton's lymphoma. So these are important because these enzymes, even though they are very helpful for us, they can contribute to chemoresistance. So this oroxylum has the ability to reduce these enzymes and increase the lipid peroxidation in the treated lymphoma cells, which is similar to the standard, the positive control, which was the doxorubicin group. And maximum lowering in case of GSH, GST, and catalase was observed at 6 hours post-treatment, and in case of catalase also, and and maximum increase in lipid peroxidation was observed in 6 hours post-treatment in case of lipid peroxidation. So in case of the test for kidney and liver toxicity, uh, these all are after 9 days of treatment with the extracts. So in case of AST and ALT, even though there was a bit rise in this AST and ALT activity, they were all in the normal range. So we can assume that there is no liver or there is no liver or kidney toxicity in the treated groups. So this slide gives the result for micronucleus in the Dalton's lymphoma bearing mice after treatment with the optimum dose, and the best extract, which was 300 mg per kg body weight of the ethanol extract. And as I have mentioned, both uh, one micronucleus bearing mononucleated cells was counted, as well as two micronucleus bearing mononucleated nucleated cells, and one micronucleus bearing binucleated cells, and two micronucleus bearing binucleated cells. All these different types of cells were counted. And in case of one micronucleus bearing mononucleated cells, the highest micronucleus was observed in 36 hours post-treatment. And in case of one micronucleus bearing binucleated cells, the highest number of micronucleus was observed at 24 hours post treatment. And this is in case of induction of apoptosis by the optimum dose, which is 300 mg per kg body weight of the ethanol extract of Oroxylum indicum and the positive control. And maximum apoptosis induction was observed at 24 hours post treatment, and it was similar. The number was quite similar after 24 hours post treatment. And these are the uh, DNA fragmentation observed in the Dalton's lymphoma cells when given the 300 mg per kg body weight of the ethanol extract, and at different time intervals. And in conclusion, the reduction in GSH, GST, catalase, and SOD, and rise in lipid peroxidation by Oroxylum indicum extract would have increased the oxidative stress in the Dalton's lymphoma cells, bringing effective cell killing in the present study. The Oroxylum indicum extract killed tumor cells and increased the tumor-free survival, which may be due to its ability to fragment DNA, induce micronuclei, and apoptosis. The reduction in GSH, GST, catalase, and SOD, and elevation in lipid peroxidation may also have played a major role in inducing DNA damage and stimulating apoptotic pathway that finally killed the Dalton's lymphoma cells and increased the tumor-free survivals in Oroxylum indicum extract-treated mice beyond 120 days. So uh, that's it for my presentation. Thank you.